we got a question that says, how do you tell your surgeon if you're unhappy with your results? This is a really complicated question, and as a surgeon, it's not one that I take lightly. This one may take more than a minute to go through. This may end up on IGTV. When you're unhappy with your results with a surgeon or a surgery, the first thing that I would recommend you do is talk with your surgeon. Go into it with an open mind and have a dialogue and a conversation about what you like, what you don't like. And then the second thing is to listen to the surgeon, because the surgeon may be saying things you don't expect him or her to say. He or she may be saying, I see it too, but it's best if we wait. Or she or he might say, I don't see what you're talking about. Or he or she might say, I'm not sure that I see it the same way. Let's get some photos and look together. So there are a lot of different approaches that a surgeon would take to this question, and none of them are absolutely correct and none of them are absolutely wrong. I think the most important thing to understand when you have something go wrong with your surgery, or if you've got results you don't love, is that the best approach is the team approach. For you and your surgeon to be on the same team, looking at the same thing, in the same way, which can be really hard to do if you're not quite happy. What you're looking at or might not be happy with may be related to things like the implant settling in a way that we couldn't have predicted. It could be things like surgical error. It could be things like the wrong implant, the wrong size, the wrong material, things that you might not have known before, but you understand or know now. It could be things like your breasts were different beforehand, and so they're going to be a little bit different afterwards. In general, when you're having a conversation with your surgeon about things you don't like, there's not one approach that needs to be taken, but bearing in mind a couple of things I think may help. One, your surgeon is also likely to be bothered if things don't end up how you want. We're human beings just like anybody else, and we tend to be fairly empathetic. Meaning if we look at someone who's unhappy, we feel for that person and we want them to be happy. No surgeon hopes that a patient leaves their office unhappy. So it creates a little bit of a psychological toll on surgeons too. As a result, if it's something solvable, many times we'd love to solve it. A second thing to remember is that timing is important, and your schedule or your ideal timing may be slightly different than your body's schedule or your body's ideal timing. You may desire something to be changed that may eventually need to be changed, but immediately after a surgery or shortly after surgery isn't the right time. You may desire something to be changed down the line where fixing it early may be a little bit easier and better for you or for your process than waiting a long time to do it. So there's a lot that goes into it, and there are 100 potential things that a surgeon or a patient might look at and wish were slightly different. One last caveat, or one last sort of things I've learned through the years that is worth talking about, is that a person will be unbelievably harsh on their own body, their own breasts, and sometimes their own results in a way that they may not be in anyone else. For example, a person may come in and be generally happy but say, I wish this breast was a little bit more like this breast, or I wish I had a little bit more cleavage or a little bit less cleavage. Or these are my favorite pictures, I wish I looked a little bit more like them, because right now when I look, my breasts look slightly different and these pictures look perfect. Well, if we sit down with those pictures, as somebody who's done this for a while and who's an expert on this stuff, I can almost always pick out imperfections in the best pictures that a person can find. But the rest of the world doesn't see those, and in truth, I shouldn't see them either. The way that a person is seen in public is very commonly different than the way that they see themselves in the mirror. In other words, we can be our own harshest critics. This is a complicated topic, and every plastic surgeon, every practice has got patients who don't feel like they've gotten exactly what they wanted or exactly what they had hoped for. Each situation is different, but if I could encourage you to consider one thing if you're in that setting, is to just have an honest conversation with your surgeon and let him or her know what it is. Listen to the restrictions that may change, whether something should or shouldn't be done, and then understanding that timing is important.